The recovery process is really extremely varied. In other words, the first thing we start with is the patient is in the operating room. He's monitored. Dr. Capilla, who does nearly all of our cases, is superb at what we call 3D echo. We can see the valve as if it was sitting in a hologram, if you would, in real space. And all these monitoring lines are in position that tell us almost everything that you can imagine about the patient. And their labs are being done every 30 or 40 minutes to make sure that they're adequately anticoagulated, that their oxygen is appropriate, their electrolytes are appropriate. And then they go to the intensive care unit, often with the tube out, because if it goes smoothly in a reasonably healthy patient, it looks like a modern miracle. The only problem is that many of these patients are really very sick, so they require intensive monitoring. The elderly often don't have an appetite, they may not want to eat, they're not as energetic as they should be because they've been active for a long time. So for some patients, the recovery is much more difficult than the procedure dictates. In other words, it seems like it ought to be straightforward and easy, but they're right at the very edge. So one of the expectations is, as time goes on, is this process will be applied to healthier and healthier patients, and then the benefit will be even more dramatic in the sense that those patients will probably act as if nothing had happened to them, or much closer to that than they would than the current selection process, which is deliberately picking high-risk patients and patients who are pretty seriously disabled.